Welcome back to the podcast, everyone. I'm Dr. Khan, and I'm joined by the ever-precise Dr. Sarah. Today, we're talking about the chassis of the human machine, the skeletal system. I like to think of bones not just as dry white sticks, but as the living, breathing structural steel of a skyscraper. But here's the thing, not all steel beams are the same shape. And in the body, shape dictates everything, from how we move to how we protect our vital organs.
That's a great way to put it, Dr. Khan. While the clinical application is vital, for our students preparing for the boards, the key is the classification system. The USMLE and other exams love to test the 5 specific categories of bones based on their shape: long, short, flat, irregular, and sesamoid. Understanding these isn't just about naming, it's about identifying the unique histological and developmental hallmarks of each.
Right, so let's dive into the heavy hitters first, the long bones. Think humerus, femur, even your fingers. They are longer than they are wide. To me, these are the levers of the body. They're like the long oars of a rowboat that allow us to move through space with efficiency.
And from a high-yield perspective, you must know the anatomy of a long bone. You have the diaphysis, which is the tubular shaft, and the epiphysis at each end. But the real testable area is the metaphysis. That's the part of the diaphysis that abuts the epiphyseal plate. In a growing child, that plate is hyaline cartilage, but in an adult, it's been replaced by bone.
And why does this matter clinically? Well, if you're in the ER and a 10-year-old comes in with a distal radius injury, you aren't just looking for a break in the shaft. You are looking at that metaphysis and epiphyseal plate. A fracture there can stunt the growth of the limb entirely. It's the difference between a simple cast and a potential lifelong deformity.
Exactly. Now, moving on to short bones. These are roughly cuboidal in shape. Think of the carpal bones in your wrist or the tarsals in your ankle. Unlike the long bones, they don't have a central marrow cavity. Instead, they are composed of cancellous bone. That's the spongy-looking bone, surrounded by a thin layer of compact bone.
I call these the box of marbles. Because they are small and numerous, they allow for a huge variety of subtle gliding movements. If your wrist was just one big long bone, you'd never be able to play the piano or type. They provide stability with a dash of multi-directional flexibility.
Very true. Next, let's look at flat bones. These are the protectors, the vault of the skull, the ribs, the sternum. Academically, you need to remember the sandwich structure. They consist of 2 layers of compact bone called tables with a layer of cancellous bone in the middle, which we specifically call the diploi.
Ah, the diploi. Why does this matter clinically? Because that sandwich is a factory. In adults, that's where the red bone marrow, the blood-forming tissue, stays active. If I suspect a patient has a blood disorder and I need a bone marrow biopsy, I'm not going to the femur. I'm heading for the sternum or the iliac crest because those flat bones are packed with hematopoietic activity. Spot on. Then we have the irregular bones. These are the ones that don't fit into the other categories because their shapes are so complex, like the vertebrae or the bones of the face. They have various surfaces for muscle attachment and often house specialized structures like the spinal cord.
They're like the Swiss Army knives of the skeleton. There's a notch for a nerve here, a facet for a joint there. When you see a vertebral fracture on an X-ray, the irregular shape makes it a puzzle. You have to consider how the pull of the attached muscles might be shifting those fragments. It's never a clean break like a pipe snapping.
Finally, we have the sesamoid bones. These are unique because they actually develop within a tendon where it passes over a joint. The largest, and the one everyone must know for the boards, is the patella or the kneecap.
Think of a sesamoid bone as a pulley. If you're trying to lift a heavy weight with a rope, it's much easier if the rope goes over a wheel. The patella acts as that wheel for the quadriceps tendon. It reduces friction and changes the angle of pull to give the muscle more mechanical advantage. Without your kneecap pulley, you'd have a much harder time standing up from a chair.
And clinically, remember that because these bones are buried in tendons, their blood supply is often quite specific. If a patient has a doctor of choice who is a top-tier orthopedic surgeon, that surgeon is going to be very careful with the vascularity of the patella during a reconstruction because bone, like any other tissue, needs its blood supply to heal.
Great point. And don't forget the periosteum, that fibrous sleeve covering the bone, is where the nerves live. That's why a bone bruise or fracture hurts so much. The bone itself doesn't feel the pain as much as that sensitive skin of the bone does.
Let's wrap this up with the high-yield summary for our listeners. Remember, long bones are for leverage and growth. Watch the metaphysis. Short bones are for stability and gliding. Flat bones are for protection and blood production in the diploid. Irregular bones are complex anchors for muscles and nerves. And sesamoid bones? Those are your mechanical pulleys found within tendons. Excellent summary, Sarah. Next time you look at an x-ray, don't just look for a crack. Look at the shape and ask yourself, what was this bone designed to do? It makes the diagnosis much more intuitive. Thanks for joining us, everyone.